when you have people wanting to pay top dollar to get in off hours, like on a Saturday, or, fit me in before clinic, please, on Friday, you end up adding a lot of people kind of last minute that are paying for that time slot. So they're texting me at Sunday, saying I need to get in Tuesday because I have a movie shoot in 6 weeks after that. Or I'm like, whoa, so there's no pressure there.
You're listening to The DIEP End, a plastic surgery podcast. Today, we're joined by Dr. Ashkan Ghavami. Dr. Ghavami is a world-renowned expert-level plastic surgeon who's board certified by the American Board of Plastic Surgery. He is sought out globally by colleagues to share his knowledge and techniques through invited lectures, textbook contributions, and scientific articles. He has made a name in the ultra-competitive Los Angeles area among celebrities as a go-to plastic surgeon for everything, ranging from cheek fillers and Botox to advanced rhinoplasty, flash recovery, breast augmentation, and the S-curve butt lift. His media appearances include Good Morning America, The Doctors, CBS News, and KTLA. More important than media appearances, however, are Dr. Ghavami's peer-reviewed scientific publications and textbook chapters. Let's jump in.
Dr. Ghavami, thanks so much for joining us on the DIEP End podcast today. I'm here with Hank, and we're excited to have you on.
Thank you. Appreciate it. Thank you for having me.
Absolutely. Yeah. And so, you, as I mentioned to you just a few seconds ago, a lot of our guests have requested to get you on, and you, everyone knows you, so I don't think I need to introduce you, but you are such an inspiration to so many people across all aspects of plastic surgery because of your dedication to things like this, education in aesthetic surgery, and also your use of social media for patients, education, et cetera. So truly, truly inspiring. And one thing that we are kind of interested in with all of our guests is getting a sense of their upbringing and perhaps things as you grew up as a kid that get molded you to who you are today.
Yeah, of course. Thanks for having me again. And thanks for starting with the roots of it. I was born in Tehran, Iran. And at that time, Iran was in its golden era with Shah as the king of the country. And it was booming. Everything was great. It was like Europe. People were from France back then would go vacation on the Gulf, the Persian Gulf, and have caviar, bottled Coke, and stay at beautiful hotels. And it was a whole different country. Mm-hmm. So when the revolution happened, a lot of people had to leave. And so my family left at that time. We came to Los Angeles. And from the get-go, my mom studied arts in London. My dad was basically kind of an engineer and also was very into entrepreneurship. And so when we came to this country, I would assist him in his job doing construction type work and things like that and building. And then my mom was always painting in the home and restoring antique furniture. So creativity was always in my blood. And also my great uncle was a very well-known a sitar player and a singer back in the day in Iran. He went by the name Fakhtehi. His name was Hossein Ghavami. And so basically, he was one of the creatives and legends in my family tree. And then I'm the first doctor in the family, first MD. So essentially, from day one, it was all about creativity. And I was always told by my parents, just love what you do. Obviously, we came here for you to have a purpose and to do well. So we'd like what you do to obviously make enough money for you to live how you want and provide for a family, et cetera. So, I didn't come from the kind of family that was materialistic and it was all about flexing your wealth and all that. It was more about fulfillment, creativity, imagination, and doing what you love.
Yeah, and it seems like I can already see where you've got your skills from having an entrepreneurial dad, an artistic mom. It kind of seems like a perfect blend for a plastic surgeon and it's kind of what you've made your career into.
Yes, exactly. And I remember actually, I when I was president of the Rhinoplasty Society in my outgoing lecture talk I gave, I had pictures of me as a kid sitting on the couch with my mom and a splint on her nose, and my dad's best friend a splint on her nose, and my mom's best friend splint on her nose. They got all their rhinoplasties in the same week back in the day in LA in the 80s. And I mean, if
Wow.
I'm growing up in a household like that, and I'm going to my post-op visits with my mom on Doheny and Sunset. Back then, it was with a guy named Maury Parks, who was the fellowship director for a private fellowship with facial plastics, and one of his fellows at the time was Raj Kanodia, who's very well known in Beverly Hills for the past few decades, working on a lot of celebrity noses through a closed technique. So it's interesting the exposure I had in Los Angeles specifically. So I can't say that didn't at least subconsciously influence me.
I was gonna say, because that was gonna be my next question. If you're the first MD in your family, like where did that come from? And then also how plastic surgery, but that seems a little bit more natural of an answer now.
Exactly. Yeah. I think it was that exposure. And then my mom probably planted the seed a little bit. And then as I got into the sciences, and as early as grade school and junior high, I just always gravitate towards the chemistry classes and watching, alchemy in there, and the science-based biology classes. I always drifted more towards that than mathematics or engineering. And I also liked writing and history and English and poetry. So right now, I think the blend of me doing academics, having my own textbook out, and writing all these articles. And at some point, I'd love to write a novel or a work of fiction and start writing short stories. So the writing aspect and expressing myself and sharing things, whether it's through social media or in written format, as well as the sciences and the creativity and the imagination that plastic surgery provides, completely is synergistic. And I'm thinking of it even more now that it makes sense talking about it, why I'm here, where I am. So thanks for this therapy session.
Yeah. Well, the first thing I thought of when you said they were sitting on the sofa with splints on their nose is hopefully you're not critiquing their noses now.
No, although my mom ended up having a revision with Bauman Gairon.
Oh,
while I was the fellow, while I was a resident there.
wow. So you trained at UT Southwestern, and Rod Rohrich was one of our first guests, and just such a great guy. He's mentored
a ball
me.
Of energy still.
Ball of energy, has mentored me from afar. He barely knew me when we first met, and since then has mentored me. And you trained under him, Fitzpatrick. UT Southwestern was the place for plastic surgery when you did your training there.
Oh yeah.
What memorable experiences do you have from Rohrich, Fitzpatrick, and that whole experience?
Yeah. I mean, it's very interesting with me. I started out at Case Western under Bauman Gairon and Edward Luce in Cleveland. So that's where I matched an integrated residency from UW-Madison, where I went to med school. So one of my early mentors was actually probably Dave DeBell, who created the Colley-Miller strut and was a craniofacial guy and a dynamic surgeon, still doing radical neck dissections as a plastic surgeon, riding on his Harley in the snow wearing chaps. And then Mike Bentz came from Pittsburgh and took over his chair my senior year. And then I ended up matching at Case Western. And in Case Western, I had such a good 3-year residency there because I would be at Metro Hospital, which is probably one of the best dynamic counties, doing free flaps and breast reductions and you name it, left and right. And then I had aesthetic training under Bauman Gairon. And post-call, instead of going home, I would go to his Ziba clinic and assist him doing endoscopic brow lifts and facelifts and rhinoplasties open. Even though I was tired, I would go there. So then what happened is my residency actually, the RSC was going to shut it down. Even though it was a great residency, there was some politics involved. So I ended up going and rematching as an independent at Rod Rohrich's program at UT. And at UT, at that moment, there wasn't an immediate space left. So between my 3-year and my 5th year, essentially, I had to do something. So instead of research, I actually did a hand micro fellowship. So my hand micro fellowship at UT was before my 2-year independent residency at UT.
Got you.
But it was all under Rohrich. So I would go to all the Thursday conferences and secretly read on aesthetics and study aesthetics during my hand fellowship.
That's amazing.
Yeah. So I was like, that's why I started writing chapters in the Dallas Rhinoplasty textbook, during my hand fellowship. I mean, it's so the exposure there was really all so heavily aesthetics. And at that time, our Thursday conference was unbelievable. We had Jeff Janis
Mm-hmm.
running a lot of it, Jeff Kenkel at the time, who's now the editor of ASJ.
Yep.
Rod Rohrich would be there almost all the time. Fritz Barton, who you alluded to, Fritz
If it's
Barton was a facelift guru, has a textbook out. High Smath, deep plane, would do that thing with a septal reset. And sometimes even a brow lift in about 4.5 hours, perfectly executed, along with a platysmoplasty. And then I had also exposure to Sam Hamra, who used to do the composite facelift. I had
wow.
exposure to, John Tebbets, God rest his
Mhm.
soul, who is one of my mentors for the way I do breast augmentation. Bill Adams at the time. So Arthur and Steve Bird, who was one of my favorite rhinoplasty surgeons there at the time, along with Rod. Essentially, I mean, it was such a great, and every Thursday felt like an ASAP's panel.
Oh my gosh, that's incredible. And
Yeah.
one of the reasons why I love doing this podcast is as an intern who has such like who's still trying to plan out the career ahead of him. Every time we interview giants like yourself, there's like all these little hiccups in the road that you
Yeah.
guys, I think what makes you guys so great is you guys are the ones that turned it into something better that
Oh
it
yeah.
happened that way. It's like
Yeah.
someone else's program has a problem and it's like going to be, it would make them quit or they'd give up or I don't know, it wouldn't amount to something as special as what you turned it into. You made it a
Yeah.
positive, which I think is such a good lesson for people listening and for people like me.
Yeah, I mean, honestly, every pro or expert in any field, whether it's a pro athlete, Olympian, a plastic surgeon, whatever it is, if you don't go through some adversity, you're not going to get to become a master. There's not a single master or expert, whether it's a Buddhist monk or a religious teacher, a spiritual guru who hasn't gone through adversity. And if you're trying to take the easy shortcuts in life and faking things, which unfortunately, your guys' generation is a little bit used to that. It's become normalized to take shortcuts and expect things right
Yeah.
away. But it's all about the long journey and the adversity it takes to get there. And it's okay to slow down and let it unfold. And, I without getting too spiritual and saying, oh, it was meant to be and this and that, probably was meant to be. It was meant to be that I matched with Bauman Gairon, had that exposure on endoscopic brow lifts and rhinoplasty facelifts right away. And then I ended up going to Dallas after that and then completing that and honing my skills and then being involved so academically from day one. My first ASAP's panel I was on, I was 2 years out of residency. And next to me was Roland Daniel, and like Sam Hammer came up to me afterwards and just said, I'm so proud of you." And I mean, those are the moments I remember. Yeah, and moments I remember and live for. And I remember that was in New York. It was New York ASAPs at that moment. So these little moments in life, the adversities, the little tiny breadcrumb rewards you get, those are the things you live for. You don't need daily, constant reassurance. And, as social media didn't exist when I was training, nobody had Instagram. Nobody cared what you drank for coffee that morning or what gym you worked out at or where you vacationed. We just heard about it on Monday when you came back. It was just a different world at that time. And so we were forced to be real. We were forced to not have to worry about what we present into the world and what we actually do.
And then you went from your training to ultra competitive LA. I don't think
Beverly Hills. Yeah.
I don't think it gets any more competitive than that.
Oh, yeah.
And now
nobody wanted me there.
and now you are, as just so you're aware, from the trainee perspective, young faculty perspective, you are who we think of as the celebrity guy. And so you've made yourself in such an ultra competitive environment. How'd you do that? Like, obviously it was probably scary at the time, but what were your pearls to success then?
Yeah. I mean, really, for me, it was just the same thing I did as an aesthetic chief resident with my chief resident clinic. I just continued that philosophy and turning people away, no BS consults, drawing before afters. I draw a lot. And so that made me stand out because a lot of plastic surgeons don't draw things. And when the fellows come through, they get used to drawing. And so all the fellows that I've had appreciate what it's like to draw and illustrate where your columnar strut goes. Why does it go there? How much of your bridge to remove? Where the implant is submuscular. Instead of showing them animation that's all fancy from our societies, I just draw it on their consult sheet. So little by little, through my drawings, my explanations, they knew based on my pedigree, the ones who were smart, even though I didn't have a lot of before afters, one patient at a time, little by little, I delivered consistent good results. That's the number one thing. In addition, I had the drive. So I'd be studying for my boards, but at the same time writing a textbook chapter for, a textbook that's coming out through like Nahai's. When I was writing a chapter for Nahai's textbook, I was studying for my boards. So like those kind of things, and doing a private practice. So I also joined Beverly Hills Physicians, which is this like full cosmetic clinic that has multiple locations where it's almost like a chief resident clinic. I would see consults from all around, lesser price or surgery, but I delivered things that they never did before. I did their first gluteal fat transfer they ever had in the entire company.
Wow.
And I did revision rhinoplasties and revision breast work and revision facelifts that a lot of the surgeons that were there at the time didn't know what to do with. So I slowly, word of mouth, developed a reputation in Los Angeles being private practice. And at that time, I was just subleasing from a guy who ran a laser center who had like 10 to 15 subleasers making money from them, me being one of them. So I had a shingle and a phone number and an address, believe it or not, in the same exact suite that I have now. So I took over the lease in
That's cool.
2011 because he didn't renew it. So I took over the lease, bought the surgery center from him, and that surgery center has such history. You know, Nancy Reagan and Phyllis Diller and all these famous people were operating on in the same exact room I used. I remodeled it. So it's all about the slow baby steps. Every step I made was deliberate, consistent. I was fully present and executing the best I possibly could. And then eventually you get the before afters, the word of mouth gets out. At that time, you know, I did hire a publicist in 2010 for a few years. I got on the doctor's TV show. I knew how to speak and present, so I presented well on TV. And then next thing you know, Instagram came around, and I was one of the third. I was actually analyzed by an independent party as being one of the first 3 plastic surgeons on Instagram showing before after. So I realized the power of Instagram back in 2012. And so I'm like, this is it. This is going to be it. We're a visual field. We show and showcase our work. What better platform than Instagram? I didn't look like Facebook at the time. Instagram made more sense to me because it was literally, even the logo for Instagram was a Polaroid camera. And so Instagram back then was a visual album. So that replaced the album I had in my waiting room.
People like my generation probably takes that for granted because it seems obvious. Why wouldn't you post your before and afters on? But people need to realize how like revolutionary that is for you to start to have the courage to take that risk, because I know from back in the day, doctors didn't even advertise regular, like non-cosmetic doctors, like on billboards and stuff like that, let alone to now super advertising, showing before and afters is a bigger deal than it sounds nowadays.
Yeah, I was very criticized. I had a lot of opportunities to be on TV shows that I gave up that would have helped me economically and financially so much more. I would have developed my practice so much faster. One of my biggest critics, actually, I consider one of my best friends now, is Rod Rohrich. He used to make fun of me for being on social media, and look at him now. He's like the guru. He's a guru himself with his own podcast, Instagram, TikTok. And at that time, he was like, when I'd go on a panel at Dallas Rhino, this is the first year I'm not at Dallas Rhinoplasty. I had to cancel it because I have so much going on right now. But basically, for 17 years straight, I was faculty there from my first year graduating. He had me back every year.
That's great.
Mostly for rhinoplasty, and then eventually my S-curve and body work and high def work. So, yeah, he was my biggest critic. People in LA and Beverly Hills weren't super happy about me doing this kind of stuff. They're like, who is this guy showing off and being flashy and being on social media and all that? And then eventually I get calls from people, by the way, like, what do you suggest I do this? How do I get my Instagram numbers up? Like, what do you think of me posting like this? And then eventually I ended up writing a kind of an op-ed in the PRS journal about the ethics of social media.
Yeah. Yeah. And It's so funny. And now I'm looking at Rod Rohrich's elevator thoughts. I mean, he uses social
I
media
was
around.
doing on the rooftop talks because back then in my building, you had access to the roof,
uh,
which was good and bad because there were days when I'm like, ugh. But
Yeah.
I was on the roof and doing these like, talks from the roof kind of thing back then. And I would do car talks on Snapchat, which was uncensored. I'd show nudity, including areola and nipples that
Mhm.
didn't need to be covered back then. Snapchat was great. So those two avenues, I was doing a lot of what people are doing now, which is talking about the surgeries, analyzing it, teaching, educating. It's always the goal is educational. So I would say ratio wise today, if you look at my Instagram, it's the same. It's about 80 to 90% educational and 10 to 20% entertainment.
Yeah.
yeah, which is important. I'm curious. I know everyone now has like their logo on a sticker for an areola.
I
What
know.
company does that? How do you even get that?
It's easy. Well, it's not sterile, so you got to make sure
Yeah,
there's no wound that's exposed when you do it. But we just copy it on
on like sticker paper.
circular sticky
Yeah,
stickers. Yeah, just like
cool.
labels. It's just a label thing. We print it on ourselves. I was the first to do that, I think.
Yeah,
Yeah.
now everyone does it.
Yep.
The other thing we wanted to ask you about social media anyways. So one other thing I'm curious about is it almost seems like patients want to be on social media. Like they take pride in having a good result and they want to show it off, at least from what I see from their photos. Do you have patients reaching out to you or requesting to be on?
I used to get more and more of this. I think the word got out that I don't really collaborate as much anymore because I don't need to.
Mhm.
So basically, there's a lot of these people that are up and coming and influencers or reality people that actually want me to talk about their story, and they go and do it on their own sometimes and make it go viral on TMZ or Daily Mail. I have a situation right now with someone who's very well known who I did a rhinoplasty on, and she wants to have it open and be out there, and I'm not sure if I want to. I know I'm now it's at this point, sometimes it helps them more than it helps me. But
Yeah.
the thing is, one of the first big celebrities I had that was open and gave interviews to Vogue and other places about having a breast augmentation with me and rhinoplasty was Iggy Azalea. And Iggy Azalea at that time was pretty big in the hip hop
Mhm.
world. And she, went and I was able to post and talk about this because she talked about it 4 days after her flash recovery Tebet style breast aug under the pec muscle. She was dancing on a pole with J Lo for the American Music Awards.
Oh my
4 days
God.
after, I was literally watching the screen and hoping she doesn't climb up on that pole because if she gets a hematoma, I'm gonna have to somehow rush through traffic to get to her. So and it was live, right? So these kind of moments are fun, but ultimately, like I always tell my colleagues, like don't be careful what you wish for, because one of the problems with being known and not having some anonymity and discretion as far as your name and having celebrities and stuff, the side benefit is obviously the word gets out in their private circles, because even if they're not open about it, they're only friends with celebrities. So
Yeah.
the word among the makeup artists and the stylists and the dermatologists and all that, and the celebrities themselves and closed circuits and in the green rooms and stuff, dressing rooms, they're talking about who did this
Of
on you, who did you
course.
go to. I just recently had someone major come back to me after previous surgery now for something that she basically apologized to me for going to someone else for, and came back to me. It's like an ex that comes back to you. It's just like
Yeah.
they don't leave. So it's a good problem to have. She came back, she's like, I talked to this and this person. They're like, why did you go somewhere else? Go to him again. So the word gets out among them, but the problem is, you know it's not a good thing. People think it's fun, but I actually don't like right now as I'm talking in this hotel, there's people walking by smiling and waving at me, and I don't know who they are. So I don't have that anonymity. It's not a great thing to have, to be honest with you. In this day and age, it's a liability
Yeah,
because
for
you
sure.
basically become a target for extortion and blackmail when people know that you're a known person.
I know.
But in general, in the celebrity world, the word gets out and it's fun because they do pay top dollar, and the anonymity I give them, the discretion I give them, they know that I'm not one of those that leaks things out and all that unless they've already talked about it.
Yeah.
I've been in many celebrity homes for post-op checks. I mean, if I could tell you stories, I mean, I had one celebrity home, I was in their huge bathroom, And 3 of my patients, I'm doing a post-op check with my nurse on 3 patients at one time in one bathroom.
Oh my, that's
Wow.
But
amazing.
that bathroom was bigger than my condo that I had a few years ago. So
I'm
Oh
pretty
my
sure.
God.
I'm pretty sure that bathroom's probably bigger than my house. So you're president of the Rhinoplasty Society,
last year, yeah.
and obviously Hank and I are very familiar with your work. What are you most proud of in terms of your contributions to rhinoplasty, and where do you think you see the future?
I honestly, my work, I feel like, has always been to figure out how to make the tip and the alar rim transition and relationship to look natural. Because you can sculpt a nose and make it look great, but if you see an artificial transition between the tip position, shape, and the alar rim, whether there's a notch, whether the soft tissue facet is deeper, whether the tip is too narrow and the alar rims are recessed, um, really points to it being a rhinoplasty. I still have a challenge with that now, especially when you're creating an entire new tip complex ala for like a black patient or a thick skin patient who needs a lot of grafts. You really have to work hard to make that transition eventually after a year or two of softening look real, look natural. So I feel like it's that. And then with that comes contributions to what people call the ethnic or non-Caucasian rhinoplasty. And my textbook is, global rhinoplasty, which if you look at the cover, the globe is made of all these different noses that make up the landscape of Earth. It was kind of my concept, and they brought it out really nicely to fruition. I can give you a copy of that too. You can show it for your viewers.
Yeah,
But basically, so the complex non-Caucasian, where you build a nose, kind of like build a bear, you build a nose out of kind of nothing and create structure for it is my contribution. And lately, all my primaries that have humps, I do dorsal preservation on.
Mm. And do you see? I'm Lebanese by origin. I was born overseas, and I
So did
think
you read my Mideast chapter in Dallas Rhino long
yes,
ago?
I did. And
That was I forced Rohrich to do that. I'm like, Rohrich, Iran and the Middle East is the number one place. This is before Korea came on the
number
map.
one.
I'm like, why do you not have a Middle Eastern chapter and you have a Hispanic and Black chapter? He's like, all right, Ash, you write it then. So I put Cyrus the Great in the first 2 pages, gave an homage to Iran's history pre-revolution, and he loved it. And then we did an article later.
Yeah. Yeah, I think it's like more common than not in Lebanon to have a rhinoplasty.
Beirut's pretty busy with it.
Very. So do you have like Iranians seeking you out or Middle Easterns like seeking you out in LA?
Oh, for sure. Yeah. I get, in the Arab world, sometimes they get very easily bamboozled. They get bamboozled by like bad advertising, and they go to some of the worst surgeons, to be honest with you. Because somebody who advertises in Dubai, or like who they see on a billboard in like, Abu Dhabi or something, or in their magazines, and they're like, oh, but the ones that do their research do come to me. I've done a lot of royal family. I've done people in political leadership positions, and their wives and daughters noses. Also body. You'd be surprised how many religious Arab patients come for S curves. But it's the ones that are well researched me out, and they come all the way from Sweden, France. The ones from Iran, I don't get as much because they can go to either Turkey or Iran. I end up getting them for revisions usually. And then I get a fair amount of Hispanic, Italian, Latinas. Lately, I've had a lot of where I always ask, what's your ethnic origin? Because I'm so interested in that. I get a lot of Italians. A lot of ethnic origins are Italian. And then the Latinas that come to me, a lot of them are ones that look Middle Eastern because they have a hump. And so I always call it too. I'm like, people probably think you're Middle Eastern, huh? They're like, yeah, I can't stand it. And then I'm like, why can't you stand it? What's wrong with that? So I make them all uncomfortable, but it's funny. It's hilarious. We have a laugh, and then I'm like, okay, fine. I'll make you look more Latina.
Is there anything that, like, if somebody comes to you, is there any cosmetic surgery related? Is there anything where you say, I want to refer you to this person because I don't do it? Or do you do basically head to toe cosmetic surgery?
So one of the reason up until recently, I haven't had a lot of friends in LA is because I don't really, for all these years, I haven't really had many people to, I've had very little people to, essentially refer out to. So the only things I really refer out, and now I don't have any reason to refer much out because I have Dr. Neil Varanis from the fellowship who joined as my young associate. Um, but I do head to toe. I know how to do, and I do lately. I've done a lot of them endoscopic brow mid face lifts, the same way I learned from Steve Bird and Bauman Gairon. I can do deep plane or other types of facelifts because of my exposure to Gairon, Hamra, Rohrich, Fritz Barton. All these people, like for me, it's just second nature. Even complex third facelifts. And then at the same time, I can do a fifth revision rhino with rib graft or MTF, but I also do revision breast work because of my exposure and familiarity with breast work. And of course, the S curve, with gluteal fat transfer. I was one of the first in LA to do it. And I was definitely the first in LA to ever publish or write about my technique, including, it was at the time really in America, the only two people talking about it was me and Tino Mendieta for a while. And then Dan Del Vecchio came on board because he stopped doing Brava and the fat transfer breast. He became a butt guy. So these kind of things left only essentially me referring out thigh lifts, brachioplasties, and body lifts. And then people that were just not body habituses that I thought would have great results.
Mm-hmm.
Right. As a trainee, my biggest question for you is kind of like if someone wants to become the best aesthetic surgeon they can be, how do they do that? And I know a lot of training programs, even since I've noticed the past few years, are putting more of an emphasis on aesthetics because so many people are interested in it. And it seems like it's becoming more a part of training than it did previously. But I still think, obviously, aesthetic fellowship is where you get most of your training. But I'm curious what your thoughts are, and I'm also curious to hear about your role at USC's fellowship and how that how often they get to interact with you and what their role is there.
Yeah, I mean, I think if your program wasn't as heavy focused as aesthetics as mine was, I think you should do a fellowship. Do I think you need a full year? That really depends on the type of program, how much independence you get, how much operating, and also depends on your comfort level and how fast you learn. If some people are really good and they can come out of a residency and probably just do a 3-month, very intense focus fellowship and be fine.
Mm-hmm.
But all the ASAPs approved ones have to be minimum 1 year. This is one reason why I didn't do my own private fellowship, because I didn't know if I wanted to hang out with one person for a full year. What if we just didn't get along or something? So I ended up joining Jay Calvert, Grant Stevens at the time. Now he's emeritus, and a bunch of the guys we have that's I've been kind of loosely their mentor for a little while, and they come to my practice, and then I became an official part of it 2 years ago. And it's through USC, but it's really a private aesthetic fellowship through ASAP sponsorship. And we take 2 a year. And so they rotate between my practice and Justin Perez, who's a fellow UT grad, who does he's busy doing a lot of volume of different things, and they get a lot more independence there too. And then Jay's practice, along with all the guys there, including Ritu Chopra and Luis Macias and the guys there. So, it's a phenomenal fellowship. And with me, like, for example, Neil Varanis and Tyler right now is finishing up a chapter for me too, in a scientific paper. Neil Varanis was the first fellow that became an editor of a clinic's plastic surgery. So the gluteal one, he helped me write a lot of it. So it was me, Pat Pasmino, and Neil Varanis. So as a fellow, he started writing that. And once he joined me, his name was on the cover, and that was the first ever. So they get a lot of experience getting themselves in the academic aesthetic world. They get opportunities to be involved with the guys. Being associated with us and us vouching for them helps them in their careers. David Stepien, right out of fellowship, became the aesthetic director at Duke. So, you can become private practice, hone your skills, have all this exposure between all the different things I do. It's one of the few fellowships, for example, where you're truly learning how to do a safe, really beautiful S-curve or BBL or whatever, fat transfer to buttock. And these guys, they sign an NDA, but we've done fat transfers on buttocks on people that some of the fellows are like, I had a poster of her up on my wall. You know what I mean? When I was in
Yeah.
college.
Yeah.
So it's a very surreal, amazing, interesting fellowship because you get the world of celebrity surrealness. I traveled with Neil Varanis, for example, to Miami to go inject a top A-list celebrity for 2 days and then come back. Like these things are not common in a lot of the different academic worlds. So you get to academia, you get to write and publish textbook chapters and scientific articles, work on research. You get exposure with about 5 or 6 guys that are super busy. And then you get that surreal, how do you manage a top tier kind of aesthetic practice that's, has so much liability that you have these A-listers relying on you that you cannot mess up on.
Yeah, I mean, there's so many points from what you just brought up. I think, and then also Tyler told us, I always envisioned an aesthetic fellowship as you go, you observe, but you don't touch the patients.
Yeah.
But Tyler just talked so much about, he credits everything to you guys. He learned so much operatively, and it's really just not an observership. So that's
definitely not.
Yeah. That's number one. And then number two is some of my best mentors and educators are cosmetic surgeons. And everyone thinks of education as academia and private practice and cosmetic surgery as not education. But my best educators, my best mentors, honestly, have been cosmetic surgeons. And to your point, like, teaching does not stop in cosmetic surgery. In fact, I think
still
it's
learning.
Yeah. So, but based off of everything you said, co-director of the fellowship, super busy surgeon. I hear you operate on the weekends. What does your typical week look like in terms of clinic days, operative days, time for your outside hobbies? What is a week?
Yeah. Well, one of the reasons I can speak to my own personal practice, I'm not sure how other people's are, but I've been told by the fellows that I have more volume than most of the surgeons in the fellowship, just volume wise. And it's hard because the volume's not easy volume. Doing a revision rhinoplasty on a celebrity and then following it up with a mommy makeover is a long day. Mm-hmm. Because guess what? That pre-op visit with that celebrity is not 15 minutes. We'll take you back. We're all ready for you. It's an hour of reviewing their photoshopped work. They bring in their stylist friend. They bring in the person that's their personal photoshopper. Like, everything takes longer. And also, when you have people wanting to pay top dollar to get in off hours, like on a Saturday, or, fit me in before clinic, please, on Friday, you end up adding a lot of people kind of last minute that are paying for that time slot. And they have sometimes access to my cell phone. So they're texting me at Sunday, saying I need to get in Tuesday because I have a movie shoot in 6 weeks after that. Or I'm like, whoa, so there's no pressure there. So that degree of pressure and everything just creates myself personally for having a very erratic, unpredictable, busy work week in general. Mm-hmm. And, to be honest with you, I'm deciding right now if I could vent on a podcast. Yes. I'm really deciding. Yeah. I've contributed for 17 years to all these conferences and this and that. And to be honest with you, after a certain point, I'm educating, I'm giving pearls away, I'm teaching, which I love, and I teach in the fellowship. But sometimes when I go up there, the energy I feel is just that of kind of haterade and a little bit of professional jealousy. And I don't really need that at my age right now in my career. So I'd rather keep some of it to myself and for the fellows and for the people that spend the time to come visit and do that. But I'm always going to be, teaching for Dallas, ASAPs. I'll always be involved with ISAP stuff, to travel to places I want to go also geographically. But my busy work weeks and everything, and then this academic leaves very little time for personal growth and, being fit, healthy, and doing stuff that doesn't involve me taking my laptop.
I know.
Yeah. And obviously you don't need to hear this from me, but if you're getting all that haterade, that means you've made it and you're at the top.
No, I realize that, but
LeBron James, and that's all anybody can talk about and hate on and comparing him to Jordan. But I mean, if you're even in that conversation, then you're one of the greats. So
I appreciate that. No, I
yeah.
agree. It doesn't make you feel that much better when it drains your energy.
No, of course.
But you're right. I'm not going to take it for granted for sure. I try to practice gratitude on a daily basis, even though it's hard when there's sometimes bullets coming at you, you know?
Yeah, of course.
Yeah. Is if your mom's anything like my mom, is she constantly saying how proud she is of you?
Yeah, she is. Honestly, she's been saying it for so long and everyone knows my name. At this point, she's basically like, okay, I get it. You got your textbook, etc. You have you're working on these celebs, this and that, and they know some of the names, actually. But the thing is, like, it's right now she's kind of like, I just want you to be happy, be fit,
Yeah.
be fulfilled, and what are you doing for yourself, kind of thing. So now
Yeah.
she's becoming more mom like, take care of yourself.
Yeah, I guess we have a few more questions because we don't want to keep you too long. But in
Sure.
terms of, taking time for yourself, things like that, we're kind of transitioning to. Do you have any regrets that if you could go back and say, I wish I did this differently, or I wish I carved out a day to myself once a week? What's the number one regret you think you have that you'd like to share with people?
Well, life is full of like new practices and habits, and I'm not regretful, but I really wish I had focused a little bit more on consistency with my health, because I've always been someone that was into like playing basketball. Like I just took up tennis a year ago. I wish I took up tennis 10 years ago, or I wish, I started racing cars in 2019. I wish I did that in 2010, but I wish I also had just the time to be consistent. But you can't have it all. So when you're developing a practice and you're in your like 30s, you have the energy to sleep a little less, hustle, drive in traffic, see that patient, visit that celebrity home, have hard hours because your body can handle it. Once you start reading that this has taken a toll on you, you got to figure out how to be a little more selfish and, give time for yourself. So that would be my only regret. Professionally, the one thing I wish is that I kind of concentrated more on the non-surgical and the lasers and the med spa about 5 years prior to when I did, so that I could have a little more established passive income. The facial plastic ENT guys usually do it by necessity because they're limited to the clavicle up.
Yeah.
And it makes sense for them to have a filler laser skincare line and all that early. But for me, I was doing so many noses, it was intuitive. I wish I did that about 5 years sooner.
Yeah. So just the last two questions are quick ones, but they're fun. What's your favorite surgical instrument and why?
Oh, I like the Tebet spatula. It's this like curved, slightly soft serrated instrument that looks like this, like an arc, and it holds the breast plant implant safely away without trauma to allow you to make pocket adjustments without taking the implant out.
Mm-hmm.
That's awesome.
Yeah,
that's the first time we heard that one. That's a new one. I like that.
Well, a lot of people don't know about that instrument. I think the only person that makes it right now is Black and Black.
Yeah, I think you're deserving of your own instruments. When we asked Dr. Rohrich what his favorite instrument was, he said, I make all my instruments.
Yeah. So, well, a funny story, I won't go into the specifics, but I worked with a company and did some napkin, scratch renditions and talked about something. I wasn't smart enough at the time to sign an NDA and all that. So they ended up developing the instrument with someone else. And kind of just, I walk in once to a conference. I'm like, wait a minute, that was my idea.
Mm-hmm.
And
What'd they say?
they were just kind of like, a bunch of BS. So I kind of got turned off to that world. You don't make a lot of money. It's more just to flex your name on stuff.
Yeah.
But I do have a gluteal set with Tulip. I don't make a penny off of it. I purposefully don't want to be owed anything to a company. So I make no money off of it. But they have their instruments that I like to be in a set for face and gluteal fat transfer. Mm-hmm. It's like the Ghavami set, and it's trademarked under my name, but I don't get a penny for it, and I don't care. So,
yeah,
that's cool.
What music do you listen to in the operating room?
Oh, that's my favorite question. So, I played guitar since I was 15. I was in a band in college. I actually was in a recording studio with a producer for a few of my hip hop patients that we bonded, and he likes me, and he actually wanted to get a guitar riff of me on a hip hop track. But the day I went, I think I got sabotaged by his main mixer, who's his guitarist. It was so stupid of me not to predict this. I think he purposefully changed the pitch of all of the tones because I could not get my guitar tuned at all to play. So that's my little tiny fun thing there. But in the operating room, if I'm doing a liposuction case, I like rock and roll, even a little bit of heavy metal, and some like kind of progressive trance house music. And when I'm doing a rhinoplasty, I like it to be chill, sometimes sappy, romantic. Yes, I play Billie Eilish this occasionally. And then, when I'm doing a long facelift, I kind of put it on classic rock, Pink Floyd, Led Zeppelin, turn the volume down a little bit. But when I'm doing liposuction S curves, it's like a club in there. The loud music inspires me, and you can ask the fellows. I will sometimes synchronize my strokes to the beat of the music.
That's awesome.
And is it like Persian music for ethnic rhinos?
Oh, that's hilarious.
No.
The only Persian music I actually kind of like is the really depressing old school sad stuff. So I just play that when I'm feeling myself on a Sunday. So yeah.
Well, we won't keep you any longer, but hopefully you had a little bit of fun.
Yeah, no, it's cool. It's awesome. I like it.
Yeah, thank you so much for joining us. I appreciate it. It was amazing.
Of course. Thanks, guys.
Thank
Have
you.
a great day.
Take care.
Thank you.
Bye.
Thanks so much.
Bye.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Spotify or Apple Music. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of plastic surgery.